When I was 27 years old, I got a genetic test to find out if I was predisposed to hereditary breast and ovarian cancer. And I found out that I was positive for the BRCA1 mutation, giving me an up to 87% lifetime risk of breast cancer and an up to 60% lifetime risk of ovarian cancer, which my mom was diagnosed with at 43. Prevention and wellness programs to me is life and death. If I could catch breast or ovarian cancer early, I could save my life.
If people had access to quality preventive health care when they need it and when it's indicated, they're going to be able to find out such things as, do I have high blood pressure?
You talk to a woman who is 30 years old to go get a mammogram, and you find the mammogram pathology on the mammogram, and this would be taken care in the beginning. She would never end up going for surgery or treatment. That's the cost of medicine. So prevention is important.
So here I am, I have the knowledge. I was convinced that if I got the knowledge, I'd be able to take care of myself. I know what my risks are, and yet there's nothing I can do about them without health insurance.
Personally, I believe that everybody should have health insurance and health care just like they should have education.
I had COBRA through my last job, and when the COBRA ran out, I was denied health insurance on a private plan through Blue Cross Blue Shield. And it was just this terrible feeling of being denied. I kept thinking I'm this healthy person, yet I'm being denied because I have this incredible predisposition.
I have a patient with a chronic migraine headache. Well, the patient started to complain of severe headaches on a daily basis. I needed to do a CAT scan. The CAT scan was refused because the patient has had a migraine before. And the headache at the present times was viewed as a pre-existing condition.
People's lives are being changed every day by their insurance companies. I had a patient the other day who has been well controlled on an insulin pump. His insurance changed, and now his insulin pump materials are not going to be covered.
Insurance is refusing to provide services for the patients, refusing to allow us to do testing, whether it be lab or x-ray, because it doesn't fit into the criteria.
I feel very frustrated that I cannot make the decisions that I want to without the insurance companies looking over my shoulder.
Well, I can tell you that the first thing that I make myself aware of when I see a patient beyond their name, age, and gender is what insurance they have. I do it because I know that any decision that I make is going to be dependent on who's paying the bill.
The doctor and the patient will make those decisions and try and decide what's the best choice. But then I think that the reality is that you can't deny the fact that somebody's got to pay for it. And so, insurance companies are not going away. And I think that that's why we have to come to some understanding about some sort of affordable coverage for everyone.
I tested positive for BRCA. I did everything I could to keep it out of my medical records because I was so worried about exactly what happened to me, about being denied coverage because I was so high risk and because, frankly, I'm expensive.
It is not unusual for patients to withhold information from their physicians out of fear that their answers to my questions will then jeopardize their health insurance.
I think it changes what the goals are. I think that it's affected what we do day to day, from taking the eye off what is that good doctor-patient relationship to one of what are the costs, what are the time, and it's more of a business model.
Nobody should stand between the doctor and the patient. No one.
So just this month, I was making my appointment for my transvaginal ultrasound, which I have every 6 months. Transvaginal ultrasound is my only chance right now at possibly catching ovarian cancer early. Because I called and I said, well, I don't have any health insurance, how much will it be to pay out of pocket? And she said, well, the ultrasound alone is hundreds and hundreds of dollars, and then you have to actually pay for the doctor's visit. I can't pay that out of pocket.
It's extremely expensive right now with the number of personnel that take care of the billing, the refiling of claims.
The intrusions that we have with the increased unfunded mandates that we now have staff doing things that we would have never even considered doing that we have to pay for.
And if you hang around here a while, you'll see sometimes it takes 45 minutes to get approval for a CAT scan or something from some of the tougher insurance companies.
And on the other side, on the phone, if any conversation should be nobody else but a medical person who understands of medicine.
If I could get back to sitting down with the patient having a nurse sort of logging everything in the visit, not ever having to deal with worrying about a phone call.
Just solely caring for that patient's health. I don't have to worry about, insurance and liability.
Defensive medicine drives up the cost of care terribly. I hope that I am not practicing defensive medicine, but we all do.
Imagine I walk in the office and there are 30 people waiting outside. You look at the patients and you just say, who's going to sue me a year from now?
Any sort of bad outcome is unacceptable, whether or not there's actual malpractice.
A doctor who's been sued is never the same. It takes away everything. It takes away your enthusiasm for medicine, takes away your confidence, and just takes away a lot of the fun that people have in medicine.
The system's broken. I would like every aspect of healthcare redone. It's not just an insurance problem, a medical malpractice problem.
And as physicians, we see every day the harm that comes to people when they don't have access to that care.
Access to health care for the seniors is continuing to erode. The reimbursement that physicians are getting from Medicare continues to go down.
It's unfortunate that somebody who's 74 years old has to drive, maybe 60, 70 miles to find a doctor who's going to see them for their Medicare.
As a senior citizen, I'm concerned about that. I think of myself as I go to try to get care from another physician, that if he's not reimbursed more than it's costing him, I may be sitting out someplace without being able to get care.
Doctors are very charitable people. They would help you any which way you need, but we need a little help too.
We need to take healthcare back and make it about the patient and the physician, and giving everybody out there the best chance to survive and live a healthy life as possible. There's no more important cause out there than giving people basic healthcare.